Well, be prepared, but don't panic. That's the message from officials here in Wichita County after the first confirmed case of the coronavirus.
Shatanya Clark is following this for us and has more on the 64-year-old resident who tested positive.
Yeah, Jaron, health officials say the patient is in isolation now at home after returning from a trip to Hungary. Now, Public Health Director Luke Kreidler says the victim and spouse flew into DFW, then drove to Wichita Falls, and the only contact was with others through the medical visit. Now, the victim's symptoms included a sore throat and cough. The spouse self-isolated from the victim and has shown no symptoms just yet. Now, one resident I spoke with says she is feeling overwhelmed but is taking the necessary precautions.
Stop freaking, and let's work this together.
Susan Phillips says both she and her husband have COPD, so staying clear of the coronavirus is of utmost priority to her and her family.
He's in palliative care because his lungs are trashed already. So any chance of him getting it is very high.
Now that Wichita Falls, Wichita County Public Health Director Luke Kreidler has announced the first case.
The patient is a 64-year-old Wichita County resident who traveled to Budapest in Hungary.
Phillips, who is overwhelmed by this news, says they will be even more cautious.
Well, we're trying to stay away from people in our isolation.
And county officials agree. They continue to stress the importance of taking all possible precautions to prevent the spread of COVID-19.
Practice social distancing, washing your hands often with soap and water, or using a hand sanitizer if water is not available.
Additionally, staying home if you are sick or staying away from those who are. Phillips also gives advice to residents who have been panic shopping.
We don't work together as a country. We won't, nothing, it'll just be people killing people over toilet paper and stuff.
Kreidler and Phillips agree residents should continue to do their part to prevent the spread of the virus. Also, United Regional officials are saying that in accordance with the CDC guidelines, testing is currently limited to individuals who meet a certain criteria and have a valid physician order for COVID-19 testing. So individuals should visit their primary care physicians to determine whether or not they should be tested and not to go to the emergency room unless they're experiencing symptoms such as chest pains and shortness of breath.
All right, good to know, Shatanya. Shatanya, thank you so much. A health district helpline is also available to residents with questions. It is right there at the bottom of your screen right now, 940-761-7909.